How do STI urine tests work? Imagine going to the doctor and providing a urine sample to check for infections. That's essentially how urine tests for sexually transmitted infections work. They focus on detecting bacteria like Chlamydia and Gonorrhea, which are common causes of STIs. The process starts with collecting a specific type of urine sample called the first catch urine. This is the initial part of your urine stream, usually the first few milliliters, because it's most likely to contain the bacteria or infected cells from your urethra or genital area. Once you give the sample, it's sent to a laboratory where advanced testing methods are used. The most common and highly sensitive method is called nucleic acid amplification testing, or NAAT. This test works by copying tiny amounts of bacterial genetic material, like DNA or RNA, making it easier to detect even very small quantities. Because of this amplification process, NAAT can identify infections with high accuracy, even if the bacteria are present in low numbers. Other methods include nucleic acid hybridization, which uses special DNA probes that stick to bacterial genetic material, and enzyme immunoassays, which look for bacterial proteins called antigens or your immune response to the infection. But NAAT is preferred because it's the most sensitive and specific test available today. It's important to know that urine tests tend to be more effective in men because the urethra is the main site of infection. For women, bacteria often resided more in the vaginal or cervical tissues, so urine tests might miss about 10% of infections compared to vaginal swabs. That's why healthcare providers sometimes recommend swab tests for women to improve detection. To get the best results, you should provide the first catch urine sample without urinating beforehand or cleaning the area. This helps ensure the sample contains the most bacteria possible. After giving the sample, it usually takes 1 to 3 days for the lab to process and return the results. During this time, it's wise to avoid sexual activity to prevent spreading any potential infection. In summary, urine tests for STIs detect bacterial genetic material or components in the first part of your urine using sensitive molecular techniques like NAAT. They are quick, non-invasive, and effective, especially for men. While they may be slightly less sensitive in women compared to swab tests, they remain as a widely used and reliable way to screen for common bacterial STIs like Chlamydia and Gonorrhea. Always remember to consult a healthcare professional for personalized advice and follow-up testing if needed.